Welcome to Tech Talks by Prolifics. I'm your host, KP. Today, we had the honor of talking with Painscript CTO Scott Cashon about their journey to help patients get the care they need. Since partnering with Prolifics in 2021, Painscript has launched a digital platform that's making a real difference for those dealing with chronic pain and substance use disorders. Their platform offers real-time, evidence-based care, improving health outcomes and reducing costs. Take a peek into the discussion. What are some of the recent projects or latest updates that you guys have been working on together?
Yeah, so just sticking to this year so far, our company is Painscript, and our initial focus and what we've kind of designed things were around pain patients, substance use disorder patients. That's been our market, but what we have launched this year, and we just signed our 6th client last night, is our second vertical, bariatrics, where we take basically the structure of the programs we develop for pain, but we have a scientific advisory board developing the clinical content, because a lot of the issues are similar, and the benefits of having that daily check-in, the monitoring, makes a lot of sense in that market as well. So that's been one of the big changes, and again, just sticking to this year, is opening up our product to beyond just the pain space. And we are now, we have 2 more that we're working with, new clients. They have signed with us without us even having the content yet, but they want to develop the content with us for physical therapy and for rheumatology. So there's lots of opportunity. The way we have kind of architected the system, and that helped building with Prolifics, is part of the reason we've been able to do that is we don't have to go build a separate bariatrics product and then go build a different, the way it's been architected is we have this general framework, and you can plug in the appropriate clinical content, rules engine, things like that. So we're able to do that kind of expansion, very efficiently. So that's yeah.
Music to my ears, because I remember being in the initial days and having all those groundwork being set, and Rajiv and the team doing a fantastic job, and taking great pains to say, and we said it to you guys from day one, we're not creating a product, we're creating a platform, and something that can be extended, so we knew that was going to happen, but it's always good to hear that is what's happening.
Yeah, and like I said, it's real. We have paying customer now and all that, and our customers are then getting paid as well. That's part of the program. Is these issues are important enough to the U.S. government that CMS has developed these codes to support practices to be able to do this remote monitoring. These are very difficult patients in a lot of instances, and the CMS sees the value in having this sort of daily touch point, or ability to early identify any issues that may be happening so they can intervene. And so that's a big part of why we're able to sell, is because the clients are going to be doing some extra work using our platform, but they're going to get paid for that work they're doing, and for smaller practices, for rural practices, to be able to entertain the thought of running a platform like this, they having that financial piece to pay their employees is an important part as well. So the other, I would say, big change that the team is helping us with right now, and again, being very flexible, being very agile, and getting it to us in time, is I don't know if you remember this. One of the things we do with, or had been doing with all of our clients, is completely white labeling the app.
Yep.
Meaning the Prolifics team will customize it, not too much, but the name, logos, colors. But we run it through the Apple Store, we run it through the Android Store. The Apple process, it takes us a month at least. And that's cool when you have 2 or 3 customers. When you have 20 that are asking why they aren't live yet, that doesn't work. And so we've made a pretty big change. And again, the team has been able to turn it around very quickly so that we're keeping things moving, of having sort of a universal version of the app that we're rebranding a little bit, but still, once the patient is logged in, the experience is branded, logos, everything else. It's just we get kind of 95% of the benefit of white labeling it with 5% of the work. So we've made that adjustment. And
okay, no, that's fantastic. So it's more of a configuration of one product rather than
right.
Not quite copy paste, but essentially it would have been something similar. Okay, so that's quite a big change. Have there been any other big changes that have gone in or are on your backlog? I know when I last maybe spent quite a bit of time with the team, there was talk about a lot of data and analytics features coming in at some point. So I don't know how much of that has actually been done so far, or how much of that's still in the backlog?
No, that's in the backlog, but it's an important piece, because what we have is, we now have one client that has about 1,500 live patients. We have 3 more that we expect to have over 1,000 by the next 3 months or so. So that's becoming more important, and we're getting a better understanding of, when you're dealing with those kinds of numbers, the kind of basic KPIs that we have right now, they're true, but they aren't really detailed enough to really manage the population. And so just on the back end that we have, now that we have the data, we're starting to look at a number of things to really let folks understand their populations, who the program's working for, who it's not, and importantly, identifying those that are on the cusp, folks that are, kind of 1 foot in, 1 foot out. That's really a different population than folks that are just like not participating at all. So I'm kind of rambling. I know I do that, but that's an example of the kinds of data analytics that are going to become more critical as we are moving from startup to, more operational clients with thousands of patients. The data you need to manage that is different than the data you need if you have 50 or 100 patients on the system. So
because the key thing for the doctor is, where do they spend their time? Where do they need to focus?
Right. And for the staff, which patients do you reach out to try to give them a little bit of a nudge to get them over the hump and really being for participants, just intelligent ways to attack that, as opposed to, blasting everybody that hasn't completed an assessment in a few days, kind of a thing.
Right. Anything else interesting on the backlog? I'm sure there's lots of interesting things on the backlog. We don't have to catch up on all of it now, but that's my curiosity, just trying to figure out.
We have all kinds of things, some big things too. Some additional things we want to do in mobile to kind of expand the types of resources we make available. I don't know if you remember, we have sort of a library of video content that makes sense for certain practices, but being able to expand that to PDFs, to meal plans, to things like that, kind of generalizing and making the app more useful, giving the patients more reason to be there. Oh, another thing that the team implemented about a month back is gamification elements as well. So in addition to doing their daily check-ins, they get to see, your streak is 5. We have little badges that come up.
Cool.
I don't know if you're like me. I do Wordle, and I can never stop because my streak is at 400. And if I break
mine's, so I'm on 66, and it took me a while to get there. And the reason I'm on 66 was I missed one day.
You missed one day, it's over.
I just missed the day. I forgot.
It'll get towards the end of the day, and I have a friend that I do this with, and she calls me if it gets to like 10:30. So Scott, don't forget, you don't want to break your sprint. Anyway, so we put those again, just some of those very basic at this point, but some of those elements in as well And like everything else we've done, we've gone from concept to efficient execution to having it out into the public in a really short time period. Just again speaks to the agility and skill of the team. In terms of taking more than being prescribed, there are a lot of controls kind of at the DEA level actually about that. So we don't get pulled in that directly, but to the kind of more general question of, how do you know if folks are how they're answering? One of the things we built in from the beginning is the ability to set alert thresholds on a patient by patient basis. And so what that means is, for me, I'm never going to say my pain is below a 6. Okay, that's my norm. Okay, so if the alert for somebody reporting that is a 5, you're going to get noise from me every day because that's me every day. On the other hand, Sham is a stoic kind of tough guy. He's not good at he doesn't like to admit to things, so he's going to say 2, 3. Now for most people that's great, that's a good day. But if we hear from Sham that it's today he's a 4, that might be something that we want to know. So one of the ways we deal with that is we know pain's especially subjective, but you're able to set at a patient level. Okay, I know my patient, Scott, 6. Okay, that's a Thursday. Okay, if he says 9, then maybe I want to look at it. But for Sham, you have the ability to set that. So again, that's been built in from the beginning with that level of flexibility. The other thing we do is we get a different information, the same information, different kinds of ways. We can ask, certain questions about, are you taking medication? But then less direct questions where you would expect a certain answer if the patient is taking their medication or is not. Like, are you able to do your daily activities? Is pain preventing you from getting out of bed or going to work? Those sorts of things. So when we design the programs, it's a mix of those kinds of direct and indirect. And by combining that into a full picture, you have a pretty good sense of what's happening.
Great. Thank you.
Yeah.
I appreciate that. Very good. Well, it was so nice to meet you, Scott. I really appreciate you going out on a whim and meeting me today.
Yeah, no, happy, like I said, been happy to, and we'll circle back in a few weeks or whatever it is, and just let me know what you need from me.
And that's a wrap on our chat with Scott Cashon from Painscript. Their story shows how collaboration and innovation can truly make a difference. Thanks for listening to Tech Talks by Prolifics. Stay tuned for more inspiring stories about tech transformations. Follow us on LinkedIn and subscribe to our podcast. Until next time, keep innovating.